Study is a very unique and valuable study looking at children in 12 communities in California, and these children at the time of this publication had been followed for about 8 years. So they were followed, the children were followed from birth until the age of 8. And what this study showed was that the children living in the more polluted communities in California had deficits in their lung growth. Their lungs were not growing as well as the children in the cleaner communities. And this was in relation to the pollutants nitrogen dioxide and the fine particulate matter, which are markers for traffic air pollution. So there's some other evidence in terms of the long-term health effects in children. This is a fairly recent study that is looking at children, again, from birth until the age of 4 or 5, in the case of this publication. These children were in the Netherlands, and what this study showed was that they observed a 20-30% increased risk of wheeze and doctor-diagnosed asthma, as well as ear, nose, and throat infections for the children with the higher cumulative lifetime exposure to air pollution. So they created a cumulative exposure from birth to age 4 in these children, and the children with the higher levels had an increased levels of asthma diagnosis. So here I'm just going to try to explain a little bit about the cardiovascular health effects because, like I said, it's not as intuitive as how the air pollution can create cardiovascular effects. So when the pollutants are inhaled into the lungs, we have obviously the direct effects on the lungs. The lungs can be irritated. There can be acute inflammation in the lungs. And this can lead to some of the respiratory effects that we've observed. But more recently, as I said, we've observed some of the cardiovascular effects. So we know what we think is happening, and we have some good evidence for this now, is that there is systemic inflammation. The inflammation that starts in the lungs becomes systemic in your body. And this systemic inflammation can create a whole cascade of events in different systems in the body. So in the heart, it can create consequences like altered cardiac autonomic function, like controlling the basic rhythms of your heart, including things like increased risk of heart attack and sudden cardiac death. It can also affect your vessels, your blood vessels in your body. So it can affect things like plaque formation and disruption when we talk about atherosclerosis becoming such a huge problem in the U.S. It can also affect things like vasoconstriction and hypertension. And we're thinking now, we're starting to get evidence that people with hypertension can be at especially higher risk of some of these cardiovascular effects. The systemic inflammation can also alter your blood morphology, basically. It increases the blood coagulability, meaning it makes your blood thicker and more prone to clotting. There's some evidence, although not as much, that some of the very small particles, the ultrafine particles, can actually go through your lungs and what we call translocate into the blood system. And when the particles get into the blood system, then it can go to any organ system in your body, including the brain. And I'll talk a little bit about that in a slide or two. So I mentioned some of the adverse reproductive outcomes. We know that pregnancy is a time that women and the fetus are particularly susceptible to environmental toxins. That we do have evidence now that increased air pollution is associated with preterm birth, low birth weight. There's some evidence that it's associated with an increased risk of birth defects, as well as with post-neonatal mortality, which is mortality under the age of 1, as well as an increased risk of SIDS. So the mortality in the SIDS, that's obvious why that's important. We're concerned about things like preterm birth and low birth weight because there are serious consequences later on in life for children who are born preterm or with low birth weight. Things like an increased risk of heart disease and diabetes later on in adults. And then there are obviously some developmental issues in children. So in terms of the neurological effects, I mentioned that this was a more recent area of research in air pollution. There's some evidence that the particulate matter, especially the very smallest ultrafine particulate matter, can enter the brain directly, either through translocation from the blood, and then it gets to the brain. There's some other evidence that the very smallest particles can actually be transported along the nerves and nasal passages into the olfactory bulb. And this is what this diagram is showing, is actually a slice of the tissue from a human brain from Mexico City. And it's showing that the particles are actually in the tissue in the brain. So the consequences of this are not well known at this time. It's a very new area of research. But there is evidence of chronic inflammation in these areas with the particles in the brain. There's also some more recent evidence of looking at what we call the black carbon component of particulate matter has been associated with decreased cognitive function in children. And I think this was a study that was actually done in Boston recently. So there's a lot of interest, and I think later on you're going to hear more about the health effects looking at specifically at diesel, traffic, or what we call these near roadway health effects. So these are studies that are not necessarily looking at one pollutant, but are looking at the effects of being near traffic or living near traffic or going to school in a high traffic area. Vehicles obviously emit substantial levels of the 4 criteria pollutants that we've been talking about, and nearly 100 of the toxic air pollutants that I mentioned. Diesel especially is of interest. The diesel emissions have been linked to respiratory and eye irritation, to headache, inflammatory changes in the body, even things like an enhanced reaction to allergen. The diesel particles can actually carry the allergens more deeply into the lungs to create a more enhanced allergenic effect. So briefly some evidence about some of the traffic studies. Again, from the Children's Health Study in California, this study has again looked at the children in these different communities in Southern California, and they observed that children living within 500 meters of freeways again have deficits in their lung growth compared to the children who live farther away from the major roadways. Traffic and the near roadway exposures have also been related to things like increased hospital visits, asthma events, decreased lung function, and asthma development in both children and adults. So I just wanted to mention there is some evidence coming from the trucking and railroad industry. They have these nice cohort studies that have been ongoing for the last 20, 30, or even more years in both the railroad and trucking industry, looking at because these are, this is a population that's very highly exposed to diesel exposure. So there are a couple of studies that have shown that railroad workers that particularly have high diesel exhaust exposure, so these are usually the conductors of the locomotives, are at increased risk of lung cancer and chronic obstructive pulmonary disease mortality compared to those workers who don't have the high diesel exposure. And there was similar findings in the trucking industry. Those workers who had the highest diesel exposure, the ones who had the very high in-cab diesel exposures, had a higher risk of lung cancer compared to the workers with lower diesel exposure. So I'm going to briefly mention some of the health effects of air toxics. There's hundreds of air toxics, and then there's hundreds of studies about those hundreds of air toxics. So I'm not going to go that in depth about these health effects. The air toxics, though, there's a long history of looking at some of the health effects of these air toxics, and they have been related to things like cancer, especially to lung cancer and leukemia. Again, to adverse reproductive health effects, to increased risk of mortality. Reduced fertility is an interesting area that there's some evidence linked with air toxics, as well as with basic immune system damage related to air toxics. So one recent study that's gotten a lot of press that I wanted to point out in terms of the health effects of air toxics, the polycyclic aromatic hydrocarbons, or PAHs, are one of the 187 air toxics regulated by the EPA. This recent study showed that higher prenatal exposures to these PAHs are associated with lower IQ scores in the children at age 5. And this is after adjusting for all the important factors that you think could be related to IQ levels in these children. So this is a very interesting recent study that has sparked a lot of interest, again, in the neurodegenerative or the cognitive effects of some of these pollutants. So in summary, I know that was a lot of information there. We've seen that increased ambient air pollution and air toxic levels have been associated with numerous short-term and long-term health effects in various populations. These observed health effects are typically for the general population and at measured ambient levels. And what we know is that pollution levels near specific sources are often much higher than those measured ambient levels that are used in these studies. And while this is not specifically addressed very often in these studies, the studies that have looked at this have not found any evidence of a safe threshold level of these air pollutants in the populations. So I'm going to stop there, and I think we're going to hold questions to the end.